ఈ భావోద్వేగాలను పంచుకోండి. మానసిక ఆరోగ్యం ఒక ప్రయాణం. We are gathered here, so I would like to invite today's chief guest, our beloved principal, Dr. Sunil Kumar sir. Please give a big hand to him. And also I would like to invite faculty and also students. And also I would like to invite department faculty, psychiatry department faculty, assistant professor Dr. Asha Monica, and our senior resident Dr. Saket Reddy, one more senior resident.
Every year we celebrate Mental Health Day on 10th of October. So, like you know, health is something which is, when you take it as a holistic entity, it doesn't only contains a physical component like whether you cough, whether you have headache, whether you have some other problem or this or this. These are all physical complaints. So apart from this, everybody in life goes through ups and lows, which encompass our mental health. So everybody, at some point of life, they have some trouble managing their mental health. So forget about treating. At least acknowledging that mental health is important is what we are trying to achieve in our country, because mental health is not taken seriously in rural population even now. It is considered as something which is not that important. Like it doesn't exist as an entity for them. So if someone is dull, if they are not working, if they are not communicating, it is considered as this fellow has gone bad. That's all. So there's no inquiry into what is causing that and all. So lots of awareness is required. So you all will become doctors, and those all will become nurses. So you are warriors. So you have to take this message to all the people in India that mental health is also important. So this particular mental health day, that is 10, and we will be having a mental health month also from 10th October to 10th of November, and we are planning number of activities targeted at different students and normal rural population and all. So if anybody is interested, you can volunteer. If you want to, we are also planning to screen people. Some of you might have some doubts. Am I, when I feel low, am I really suffering for something, or do you have anything like depression or anxiety? So we will give you an opportunity to screen yourself. If someone is willing, please contact our department. So this is a drive which we are conducting. That is screening for mental illness is a drive which will be conducted in our department this month. So don't hesitate. If you have even the slightest doubt, or if you want to check it also, please feel free to come and communicate with us.
So we have to communications with properly with patients. We have to know the symptoms and causes. So we will find out where it is main factors. So now we are the one type of volunteers. So when we are going to our communities, any of our patients, see we have to find out the reasons. Then we will give them some proper management. So what is going on? So misconceptions like communications lack of. So we will advise them. So thank you for the
good point that communication is the key. Everyone this is the first step of treating a patient. Everyone feels this stigma is encompassed over in our society, right? Like speaking to a psychiatrist, going to a psychiatrist is a great stigma, right? So first step we need to change is to reduce that stigma. first step is encouraging the patient to reach out to the doctor first. So that would be a great help. So communication is a basic key for the mental health. So that is aptly addressed by the madam. So now I request Dr. Sunil sir to call upon Dr. Dimple, a senior resident in the Department of Psychiatry, to talk to you guys.
Dr. Dimple, I'm senior resident in Psychiatry Department. I completed my PG in Gandhi Medical College. Actually, most of the medical students and nursing students are also don't know anything about psychiatry or mental health or mental illness. Recently, I get to know that one of the intern from Gandhi Medical College, who actually completed his internship, has committed suicide by paraquat poisoning, and he died 1 week back recently. And I know him from the psychiatry postings only, because interns have psychiatry postings for 2 weeks, and I think he haven't learned anything from that psychiatry postings. So do most of the students, medical students and nursing students are also not learning anything, because for you psychiatry is like 10 marks in your theory exams and 2 weeks of postings in your UG and 2 weeks of postings in your internship. It's not more than that. But mental health is way more beyond that, because if any part of your body is not working, you can fix it, or if it is not working also, you can continue your daily works as usual. But if your mind is not working properly, if your brain is not working properly, you cannot continue any activity even though every part of your body is normal. Okay? But most of the doctors don't want to communicate those kind of things. Here in psychiatry department, we are very much open to have conversation with all the doctors who are having problems in their daily life, in their exams, in their stress management, or those who are having proper mental illness also, we will treat them. And if you are not that much open about that, we can keep all of those things confidential also. And recently there have been a app that been launched only for doctors. It is FIMA. You can call anytime. It is available 20 hours for 7 days. So there will be psychiatrists allotted for you. So if you need any psychiatric help, you can call them and you can take advice. Currently your seniors are having exams. If they are being too stressful or not having some sleep problems and they don't want to attend psychiatry here, they can call the FIMA and they can take advice from that also. So I hope you make psychiatry more make and incorporate psychiatry in your lives more than just marks and some 2 weeks postings that you have in your UG and internship. Take it seriously. It is very needed for your family and your life. And look out for the people around you. Okay, so that's how you know if there are any changes that been made, so you can track what is happening with them, so you can prevent those kind of incidents that's been happening. Because he is also a medical student, that one who died, and he also attended psychiatry, but he did not reach out. But those people who have attended along with them, his friends, even if they have noticed little changes in him and would have reached out, he would be alive by this time. So look out for your friends in any changes in behavior, and seek active attention. In psychiatry, we don't judge anyone, okay? So it's not something that we do here. So you can come and talk anything, any kind of thing, and we will take it, and if it is needed, we will provide all kind of solutions to you. And once again, keep in mind that FIMA is there for all the doctors. So who want to reach out for the mental health of the who are having stress also, if they can reach out. Don't forget, if you want, I will send the number to your CR. Okay? Thank you.
Today we have gathered to observe mental health state. As medical students, we study in detail about our physical health, every muscle, every nerve, everything. But do we even stress on our mental health? Do we ever talk about mental health? We go through a lot of stress, our exams, our practicals, results, will we be able to pass or not? I would just like to say mental health is as much important as physical health. It is okay not to be okay. I would say जागरूकता ही पहला इलाज है in Hindi. Awareness is the first treatment you can give. Support, don't stereotype. Thank you.
Committee members and all my batchmates. As my fellow batchmate said, जागरूकता ही पहला इलाज है. It is true, we totally read about all types of physical health, all problems, pathology, medicine, all about that. But we hardly stress about our mental health and all that thing about our day-to-day lives and the problems we deal with, etc. And we don't, it's a taboo here to discuss about anything that we are related with our psychology or, so it's a great initiative by our psychiatry department to conduct a mental awareness. Thank you all the respected teachers for a great initiative and hope we do nice things. Thanks.
In active participation. Asha from Nursing College to
dignitaries and all of you present here. So what I'm going to, so today as we are celebrating here, creating awareness on Mental Health Day. So I just want to say that we should also normalize the mental health. Like people are not normalizing mental health. So what I want to say that we should also normalize this mental health disease as how we are dealing with the other disease condition, so that people will say about this. Still in many people living in community area, those who are not getting awareness about mental health, they feel it is a myth, it is some other like spiritual so on things. So I just want to say that we should also normalize mental health diseases in society, so that we can create awareness.
morning everyone, respected dignitaries. Today's chief guest, our beloved principal, Dr. Sunil Kumar sir, and nursing college superintendent, and our department faculty, assistant professor Dr. Asha Monika, and senior resident Dr. Saket Reddy, and Dr. Dimple, and all the medical students and nursing students. Very warm welcome to you. So, how many of you know about Telugu? So, have you read this pamphlet? So, ఇది తెలుగులో తెలుగులో ఉన్నాయి సిమ్టమ్స్ అన్ని. ఎందుకంటే మీరు లోకల్ లాంగ్వేజ్ తెలుగు కాబట్టి మీరు ఏంటంటే ఈ పాంప్లెట్స్లో ఉన్న సిమ్టమ్స్ అన్ని మీరు సర్క్యులేట్ చేయాలి, వాళ్ళతో ఇంటరాక్ట్ కావాలి. ఇందులో ఎవరైనా చదివారా ఈ పాంప్లెట్? తెలుగులో ఇచ్చాను నేను. ఎంతమంది చదివారు చెప్పండి? Can you raise your hands? How many of you have read this pamphlet? Pamphlet, especially anxiety. Anxiety ఎలా ఉంటుంది? పేషెంట్ వస్తే ఫస్ట్ క్లినిక్ ఎలా వస్తాడు? సైకియాట్రిక్ క్లినిక్ ఎలా వస్తాడు? ఎప్పుడు వస్తారు? ఫస్ట్ ఆఫ్ ఆల్ మీకు లోకల్ లాంగ్వేజ్ ఐడియా ఉండాలి. ఎందుకంటే గుండెలో దడదడ, భయం, పాల్పిటేషన్, ఫియర్ఫుల్నెస్, ఓకే, ఊపిరాడకపోవడము, కడుపులో వికారము, గొంతు పట్టేసినట్టు అనిపించడము, ఛాతీ నొప్పి రావడము, ప్రాణం పోతుందని భయం ఉండడం, ఇలాంటివి ఉంటాయి. దీస్ ఆర్ ఆల్ సిమ్టమ్స్ ఆఫ్ యాంగ్జైటీ. ఓకే, సెకండ్ ఓసిడి. హౌ మెనీ ఆఫ్ యూ నో అబౌట్ ఓసిడి? అబ్సెసివ్ కంపల్సివ్ డిజార్డర్. సో ఎలా ఉంటుంది? మనకు వచ్చేవాళ్ళు పేషెంట్స్ ఎలా ఉంటారు? పదే పదే అపరిశుభ్రమైన ఆలోచన రావడం, రిపీటెడ్ అన్వాంటెడ్ థాట్స్, అదే పనిగా చేతులు కడగడము, తుడవడము, చేసిన పని పదే పదే చేయడము, ముట్టిందే ముట్టడము, కడిగిందే కడగడం. సో దీస్ ఆర్ ఆల్ సిమ్టమ్స్ ఆఫ్ ఓసిడి. ఓకే, డిప్రెషన్. వాట్ ఆర్ ద సిమ్టమ్స్ ఆఫ్ డిప్రెషన్? కోర్ సిమ్టమ్స్ ఆఫ్ డిప్రెషన్: sad mood, loss of interest in pleasurable activities, easy fatigability. సో ఇందులో ఉన్నాయా చూసారా? మనసులో బాధగా ఉండడము, శ్రద్ధ ఏకాగ్రత లోపించడం, లాస్ ఆఫ్ అటెన్షన్ అండ్ కాన్సన్ట్రేషన్, స్కిన్ డిస్టర్బెన్స్, లాస్ ఆఫ్ అపెటైట్, నెగిటివ్ థాట్స్, suicide thoughts, pessimistic ideas. These are all symptoms of depression. Okay, what are the symptoms of mania? Very good. Over excitement, ఉంటారు పేషెంట్స్, ఎలా ఉంటారు? చాలా మంది పేషెంట్స్ ఎలా ఉంటారంటే ఈ మేనియా సింటమ్స్ ఉన్న పేషెంట్స్ మీరు క్లినిక్ వస్తుంటే వాళ్ళు ఎక్కువగా మాట్లాడుతుంటారు, డ్యాన్స్ చేస్తుంటారు, పాటలు పాడుతుంటారు. తర్వాత వాళ్ళు ఏంటంటే నాకు ఇవాళ ప్రైమ్ మినిస్టర్ నరేంద్ర మోడీ తెలుసు, చీఫ్ మినిస్టర్ నరేంద్ర మోడీ తెలుసు, మన రేవంత్ రెడ్డి తెలుసు, వీళ్ళందరూ నాకు తెలుసు, నా ఫ్రెండ్స్ అంటారు. ఇప్పుడే బ్రేక్ఫాస్ట్ నేను ట్రంప్తో బ్రేక్ఫాస్ట్ చేశాను. లేకపోతే నేను జస్ట్ ఇంకా ఇట్లా నేను జస్ట్ ఒక విజిల్ వేసేస్తే ఈ ప్రపంచం అంతా నేను కంట్రోల్లో తీసుకోగలుగుతాను. ఇలాంటి సింటమ్స్ ఉంటాయి. దీస్ ఆర్ ఆల్ సింటమ్స్ ఆఫ్ మేనియా. ఓకే, సో చదవండి ఒక్కసారి. మీకు ఏంటంటే పబ్లిక్ అవేర్నెస్ చేయాలి. ఎందుకంటే మనము వీ వుడ్ లైక్ టు కండక్ట్ mental awareness month, so we should educate our local people, so that's why we have prepared this pamphlet in Telugu language, so everyone should read and educate the local people. Okay, and what are the symptoms of suicide? How to identify the suicide? Okay, depression is one of the symptom, and ఎలా ఐడెంటిఫై చేస్తారు? మన పక్కన ఉన్న వాళ్ళనే మనం ఒక 100 మెంబర్స్ ఉన్నారనుకోండి, అందులో అట్లీస్ట్ ఒక 4-5 మెంబర్స్ డెఫినెట్గా సూసైడ్ పార్ట్స్ ఉంటాయి. దట్స్ నేను చెప్పేది కాదు, వరల్డ్ హెల్త్ ఆర్గనైజేషన్స్ స్టేట్మెంట్ ఇది. సో మనకి ఏంటంటే మెయిన్గా మీరు ఏం చేయాలంటే పక్కన ఉన్న మీ స్టూడెంట్స్ని లేదా ఎవరైనా ఉంటే వాళ్ళతోని మాట్లాడుతుండాలి. ఎవరైనా ఇట్లాంటి నెగిటివ్ థాట్స్ ఉంటే మీరు కంపల్సరీ వాళ్ళని పక్కన కూర్చోబెట్టుకొని అడగాలి. లేదా వాళ్ళని చెప్తుంటే వాళ్ళ నెగిటివ్ ఈజీగా తీసుకోవద్దు, వాళ్ళతో ఇంటరాక్ట్ కావాలి. సో what are the symptoms of schizophrenia? Schizophrenia. Very good. Very good. How many types of delusions in psychiatry? What are the types of delusions? Very good. Persecuted delusions, delusions of love, delusion of reference, delusion of infidelity. ఎలా ఉంటుంది? స్కిజోఫ్రీనియాలో చాలా మంది అనుమానం ఉంటుంది. అంటే మనకేంటంటే సొసైటీలో చాలా మంది డెలిషన్స్ ఉంటాయి. సో వీటిని ఐడెంటిఫై చేయడం ఇంపార్టెంట్. వాళ్ళకి ఏంటంటే అనుమానాలు ఉంటాయి. పక్కన వాడు నా గురించే మాట్లాడుతున్నాడు, లేదా వాడు నాకు చేతబడి చేస్తున్నాడు, ఇలాంటి సింటమ్స్ వస్తాయి. సో అది మనం ఏమనుకుంటామంటే ఏదో వాడు అట్లా ఇట్స్ అ కైండ్ ఆఫ్ డిజార్డర్. ఇట్స్ డ్యూ టు ఇంబ్యాలెన్స్ ఆఫ్ ద న్యూరో ఎస్పెషల్లీ disturbance of imbalance of serotonin and dopamine. Okay, so we should identify the symptoms, especially we should identify the delusions. Okay, so like the persecuted delusions, delusions of reference, delusions of infidelity, delusions of love, delusions of grandeur. We should identify these types of symptoms in psychiatric patients. Okay, and what are the somatoform disorders? What are the symptoms of somatoform disorders? Somatoform or hypochondriasis or and what are the symptoms of addictions? How many types of addiction in society? Drugs, very good. Alcohol, very good. Cigarette smoking, very good. Very good. Porn addiction. Very good. Mobile phone addiction. Very good. TV. Very good. TV addiction. Food addiction. Very good. Good. Maybe adulteration. And nowadays, very very important addiction. Online betting, cricket betting. And can you say about other addictions in Jagicha? Very good. Ganja. What is the scientific name of ganja? Cannabis. Very good. Cannabis. So మన దగ్గర గాంజా అడిక్షన్ చాలా ఉంది. సో మీరందరూ ఏంటంటే ఎస్పెషల్లీ లోకల్ పీపుల్లో, ఎందుకంటే కాలేజెస్లో కానీ లేకపోతే ఆశా వర్కర్స్ కానీ లేకపోతే మెడికల్ ఆఫీసర్స్ కానీ లేకపోతే సరౌండింగ్ వాళ్ళతో మీరు ఇంటరాక్ట్ అయ్యి ఈ డ్రగ్ నికోటిన్ రీప్లేస్మెంట్ థెరపీ మన డిపార్ట్మెంట్ వీఆర్ ఆఫరింగ్ సమ్ స్పెషల్ ట్రీట్మెంట్స్ ఇన్ డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీ, ఆల్కహాల్ డిటాక్సిఫికేషన్, డి-అడిక్షన్ అండ్ నికోటిన్ రీప్లేస్మెంట్ థెరపీ అండ్ along with some psychotherapies. So we are providing all the sophisticated therapies in our department of psychiatry. So kindly educate the people. Okay. And what are the symptoms of dementia? Have you ever seen dementia patient? What are the symptoms of dementia? Very good. Very good. Forgetfulness. What are the cognitive functions? Can you any? What are the cognitive functions? Attention, concentration, memory, orientation, intelligence, abstract thinking. These are all cognitive functions. Okay. So disturbance of cognitive functions may occur in dementia. So we should identify we should identify these type of patients. Okay, in our society. So thank you very much for giving this opportunity. Now I would like to invite today's our chief guest, our beloved principal, Dr. Sunil Kumar sir. Please.
Friends, and I want to congratulate the Department of Psychiatry for conducting successfully this event. And today, every year on October 10th, we will be celebrating World Mental Health Day, and this is conducted under the guidance of WHO, and every year they will give a theme progress based on the burning issues at that time. So this year they had given the theme access to services, mental health in emergencies and catastrophes. So as this is a global burden, national burden everywhere, they had stressed on this issue. So you are seeing all over the world many conflicts going on, like Ukraine, Russia, or Middle East, Central Africa, and you have many conflicts, you have many disasters like floods, earthquakes. Recently in Hyderabad we had Musi river floods, like that. So in these conflicts, emergencies, many will get displaced, there will be refugee population, many will lose their livelihoods, many will lose their financial and economic recession they will face. So all these lead to trauma, emotional trauma. So especially in these during conflicts, emergencies, 1 in 5 will be suffering from mental health disturbances, like the psychosocial impact of these conflicts, like what Dr. Vishal sir has told, anxiety, depression, post-traumatic stress disorders, appetite, sleep disturbances, chest pain, shortness of breath, everything they will be getting. So to overcome this, the governments, they are stressing on mental health. So they are telling that mental health is a basic human right. It's not a privilege, but it should be included in all core interventions. And also they had, the WHO has told, in emergency disaster response, addressing mental health also is a very important part of this disaster response. This is mental health is not a luxury, but it is a basic normal what we have to do in everything. And also, as you are going to be getting trained as health professionals in your holistic health care also, you have to address mental health needs also in every, not only treating physically, but you have to address the mental health also, not only protecting the heart but also protecting mind also is very important. So what they say is that, and also there is some terms like concepts in mental health, like psychological first aid. During conflicts, disasters, injuries, you will be treating the patient, you will be giving drugs, and also there is something called psychological first aid also. In that psychological first aid, you will be talking about empathetically, treating them compassionately. You will be addressing the social stigmas, you will be reassuring them, counseling them. For them, the psychologists, the social workers, all will be involved in that emergency disaster response. So this psychological first aid also is a very important core intervention. And also minimum support package, and also you have mental health, psychosocial support, MPHSS packages, all these in addition to health, nutrition, shelter, food. These mental health needs also will be addressed. And also community support, intersectoral coordination, all of these part of mental health needs only. and your mental health at workplace. To overcome them, you have to maintain good time management, stress management, work-life balance, mental well. These are all part of mental well-being. So today we had conducted rally to mainly to stress to the public regarding awareness about mental health, to openly talk to the people about openness about their mental health needs, and also to remove this social stigma, and also to identify early and treat them, so that the families and communities cannot get fractured and lead to some loss of lives and all these things. So today let us pledge for taking this mental health to every aspect of society needs, and I congratulate once again the Department of Psychiatry for organizing such a good event. This is a month-long drive which will be taken up, and you all actively participate, and also include mental health in a routine part of your health care. Thank you.
In that pamphlet, there is a small underscore where
మానసిక వ్యాధులు మన మెదడు మరియు భావోద్వేగాలతో ముడిపడి ఉంటాయి. సైకియాట్రిస్టులు ఈ వ్యాధులను గుర్తించి మందులు, కౌన్సిలింగ్, కాగ్నిటివ్ బిహేవియర్ థెరపీ ఇచ్చి నిర్వహణలో సహాయపడతారు. వారు మీ జీవిత శైలిని మార్చడానికి సలహాలు ఇస్తారు. ఒత్తిడిని తగ్గించి మీరు సాధారణ జీవితం గడపడానికి మార్గదర్శకులు అవుతారు. గ్రామీణ ప్రాంతాల్లో ప్రభుత్వ ఆసుపత్రుల్లో ట్రీట్మెంట్ ఉచితంగా లభిస్తుంది. భయపడకుండా మాట్లాడండి. సైకియాట్రీ చికిత్స పొందండి. థ్యాంక్ యూ వెరీ మచ్.
So this is not a one-day event. This is, as Principal Sir has said, this is a month-long drive we are going to do from the Department of Psychiatry. We all we request your presence and in every activity, and you have given your 100% in it. Thank you for it. And this should not stop here. My message is this: like, this is not a one-day event for any mental event. We can reach up to at least 25 to 50 people through our social media communications, right? So this is not an era of, like, we are in 2025. If we keep one status, it will reach like minimum 100 to 200, right? So we are around 100 people here. Can we reach up to 10,000? If we really want to keep propagated, yes. So the material to it, we will share it to your CRs. It will be in all the languages. So please share it in your social media accounts so that it will reach everyone. Whatever we do, it should have some weightage. Like, the society should gain from it, right? So this is how we can do it. So we'll share this the material to the CR. It will be posted in your group, and don't hesitate. I'm requesting every student, do not hesitate if you have any minor issue also. This is the age where if you have some stress, you look up to, you have most of the deviations at this age. Okay, like if you are little stressed up, you'll look up for alcohol or any other drug. So that is a very worst way of doing it, because the biggest chemical factory in the world is this, right? So if you want to be happy, it is from within. If you want to be sad, this is from within. You can make it from within. Like, you don't need external supports like alcohol, any substances to make this happy. You know where cannabis is produced in our body? Is it produced in our body? So initially, like 200 years back, we didn't expect that we had these cannabinoid receptors. But researchers said that we had cannabinoid receptors. We can produce this endocannabinoids. You heard of this? We have something called anandamide cannabinoids in this. So what happens with external substances is, if you take that substances, your awareness is reduced, but you will be blissful. But there is no point in having reduced awareness. When you have when you increase your endocannabinoids or internal serotonin, if you learn to use it right, you will be blissful. At the same time, you are completely aware. This is what a human brain is designed. This is how it is designed. But we need to know how it is functioned. We all study in great detail how liver functions, kidney functions, brain functions. But the main thing is we forget how the mind functions. Did we study it? And where is the mind? Never mind. And I am warning you, this is not, your mind is not in the brain. Okay. Okay, with this, I want to conclude my thing. And thank you everyone for making this a huge success. I thank Principal Sir, HOD Sir for always encouraging us to do such activities, and our Assistant Professor and nursing staff also for making it a big success. Thank you.
Today, on behalf of Government Medical College Jagitial, we had conducted World International Mental Health Day as part of the WHO involved recommendations, and every year on October 10th we conduct World Mental Health Day, and this year the theme was access to services, medical health in emergencies and catastrophes. So regarding this day, we conducted social awareness, we had conducted rally and information, education, communication activities. We involved the students of our college and the nursing students also, and a rally was conducted. We brought awareness into the public regarding the importance of mental health, and also we talked regarding openness and to share their mental health needs and to prevent social stigma due to this psychosocial disturbances. And as part of this, the Department of Psychiatry in our college got actively involved with the involvement of the professor and head of the department, Dr. Vishal, who actively participated, and we had distributed pamphlets also. We had given a social message, and we stressed in the students to spread this social message to many people in their surroundings, acting as a volunteers and peers. So we will take this as a month-long drive, and we'll educate in the public, into the degree college students, schools, about the importance of mental health, and also the mental health at a workplace also was advocated to the faculty, employees here, and we all pledge to take this program as part of holistic care, and also this as a psychological first aid during routine normal activities also.
నమస్తే. ఇవాళ ప్రపంచ మానసిక ఆరోగ్య దినోత్సవం 10th అక్టోబర్. గవర్నమెంట్ మెడికల్ కాలేజ్ జగిత్యాలలో వైద్య విద్యార్థులు మరియు నర్సింగ్ విద్యార్థులు కలిసి అవగాహన ర్యాలీ నిర్వహించడం జరిగింది. సో ఇవాళ మెడికల్ కాలేజ్ ప్రిన్సిపల్ డాక్టర్ సునీల్ గారి ఆధ్వర్యంలో ఆయన డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీ ఫ్యాకల్టీ అండ్ అందరూ ఇందులో పాల్గొన్నారు. ముఖ్యంగా సమాజంలో శారీరక ఆరోగ్యానికి ఇచ్చినంత ఇంపార్టెన్స్ మానసిక ఆరోగ్యానికి ఇవ్వడం లేదు. సో అందుకే సొసైటీలో అవగాహన క్రియేట్ చేయడానికి ఇవాళ ఈ కార్యక్రమం ఏర్పాటు చేశాం. ఇందులో చాలా రకాల లక్షణాలతో కూడిన పాంప్లెట్స్, అంటే ముఖ్యంగా ఇలాంటి ఈ మనకు రోగులకు కానీ, తర్వాత వాళ్ళ అటెండర్స్ కానీ, తర్వాత ఇక్కడ ఉన్న వాళ్ళకందరూ డిస్ట్రిబ్యూట్ చేయడం జరిగింది. ఈ పాంప్లెట్స్లో ముఖ్యమైన ఉద్దేశం ఏంటంటే, యాంగ్జైటీ అంటే చాలామందికి అవేర్నెస్ లేదు, ఆందోళన అంటాము. తర్వాత పిల్లల్లో కొన్ని సమస్యలు ఉంటాయి, ఈ ADHD కానీ, ఆటిజం కానీ, ఇలాంటి కొన్ని మానసిక సమస్యలు ఉంటాయి. వాటిని కూడా ఇందులో చెప్పడం జరిగింది. ఈ OCD అంటే అబ్సెసివ్ కంపల్సివ్ డిజార్డర్ పైన లక్షణాలు ఎలా ఉంటాయి అనేది వివరించడం జరిగింది. డిప్రెషన్ చాలామంది డిప్రెషన్ వలన సూసైడ్ చేసుకొని చనిపోతున్నారు. సో వాటిపైన కూడా అవేర్నెస్ క్రియేట్ చేయడం జరిగింది. అయితే అంతేకాకుండా కొన్ని రకాల మత్తు పదార్థాలు ఆల్కహాల్ మత్తు పదార్థాలు బానిసైన వాళ్ళకు కూడా ఎలాంటి చికిత్సలు ఉంటాయనేది డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీలో ఎలా అయితే చికిత్సలు ఇస్తున్నాం కూడా ఇందులో అవేర్నెస్ చేయడం జరిగింది. సో కాబట్టి ముఖ్యంగా మానసిక సమస్యలు కానీ ఏమైనా ఉన్నట్లయితే, అడిక్షన్స్, ఈ ఆల్కహాల్ కానీ, సిగరెట్, గుట్కా, గంజాయి, తంబాకు ఇలాంటివి ఎవరైనా ఉన్నట్లయితే డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీకి వచ్చినట్లయితే మా దగ్గర ఉన్న ఫ్యాకల్టీ స్పెషల్ ట్రీట్మెంట్స్ ద్వారా వాళ్ళకి నయం చేయగలడానికి ఇక్కడ డిఅడిక్షన్ వార్డు కూడా ఉంది, సదుపాయాలు కూడా ఉన్నాయి. సో కాబట్టి ప్రజలు వీటిని వినియోగించుకోవాలని నేను డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీ తరఫున రిక్వెస్ట్ చేస్తున్నాను. థ్యాంక్ యూ.
అందరికీ నమస్కారం. నా పేరు డాక్టర్ సాకేత్ రెడ్డి. నేను గవర్నమెంట్ మెడికల్ కాలేజ్ జగిత్యాల అసిస్టెంట్ ప్రొఫెసర్గా పనిచేస్తున్నాను డిపార్ట్మెంట్ ఆఫ్ సైకియాట్రీ తరఫు నుంచి. సో అక్టోబర్ 10th మెంటల్ హెల్త్ డే అవేర్నెస్ డేగా మనం పరిగణిస్తాము ప్రతి సంవత్సరము. ఆ రోజు మెంటల్ హెల్త్ గురించి ప్రజలకి సమాచారం కానీ, అంటే చాలామంది మెంటల్ హెల్త్ అంటే ఏదో స్టిగ్మాతో చూస్తారు, అంటే సైకియాట్రిస్ట్ దగ్గర రావడానికి ఇష్టపడరు, నాకేదో ఇబ్బంది ఉందని బయటికి చెప్పుకోవడానికి ఇబ్బంది పడతారు. సో ఈ స్టిగ్మాని తగ్గించడానికి ప్రతి సంవత్సరం ఈ రోజు అనేది యాక్టివిటీస్ చేసి మేము ప్రజల్లోకి తీసుకెళ్తాము ఈ అవేర్నెస్ కోసం, మెంటల్ హెల్త్ అవేర్నెస్ కోసం. సో దీని పరంగా ఇవాళ మెడికల్ కాలేజ్లో ర్యాలీ అండ్ సింపోజియం చేయడం జరిగింది. సో దీంట్లో భాగంగా ప్రజల్ని ఎలా అవేర్నెస్ ఎలా పెంచాలి, ప్రజలలో ఏమేమి చెప్పొచ్చు, ఏమేమి మార్పులు తీసుకొని రావాలి సొసైటీలో అనేది స్టూడెంట్స్తో డిస్కస్ చేయడం జరిగింది. సో ఇది నెల 30 రోజులు, ఈరోజు 10th అక్టోబర్ టు 10th నవంబర్ వరకు ఈ నెల మొత్తం మేము డిపార్ట్మెంట్ తరపు నుంచి ప్రోగ్రామ్స్ చేయడం జరుగుతుంది.